You're listening to Holy Health, the podcast that brings you the latest in health ideas and technology across the spectrum of fields. While ultimately our fate is up to God, how we get there is determined by us. As it says in Kohelet, there is nothing new under the sun. We get that everything can be found in Torah. Our goal is to empower you with knowledge that may help you make better lifestyle choices. This podcast has been brought to you by Musach Haguf Physical Therapy and Personal Training Studio. Our motto is fixing the past in order to build the future. You can find us on Instagram at Musach Haguf. I'd like to thank the sponsor of this week's podcast, Luach Aim. We build websites that soar. You guys should totally go check out my new website, holyhealthpodcast.com, to get an idea of what Luach Aim could do for your business. Contact Sarah Lee at +1 845 596 0842. She's going to help you bring your ideas into a tangible business presentation, whether through graphic design alone or a whole new website. Use code HOLYHEALTH for a special discount. Hey guys, just jumping on here for a quick intro to today's topic. Dr. Courtney Connely from Gate Happens. And this is not the first podcast I've done. This is episode, I believe, 45 that's coming out. It might be 46. I have to look when I go to post it later. But this is actually the third person I've had on talking about feet. Those of you who know me or who've come to me as a physical therapist know that I've been very into the barefoot movement and very into foot function for many, many years already. And each one of these people has brought sort of a different perspective on a similar topic. And I absolutely loved speaking with Dr. Connely. Some of you, or a few of you, I would say 10 of you on Buzzsprout and 5 of you on YouTube were lucky enough to hear last week's podcast before, within that first hour where we caught that it had gone up unedited. So there were some areas today where I thought maybe I could edit things, and I decided to leave a lot of it because I felt like there was just a very natural flow to our conversation. And I loved speaking with Dr. Connely. She's an extremely spiritual person, which fits right in with what we're trying to do here. And I thought this would be a great week to put it out because for the first time in 4 years, I'm going to the United States to attend a functional gait analysis course with her this weekend. And I am beyond excited. As much as I know about feet, there is just so much more to learn. And I'm really, really looking forward to going and to attending this course for the first time in many, many years. I also find feet interesting myself, and I was really hoping to learn because I have heard in the past, and if any of you know where I can find this, somebody please contact me, that different parts of the body are related to different mitzvot or to different commandments. So I was hoping to find something about what commandment feet are related to, because the only issues I've ever had, and I would say about 3 times in my life, I broke my ankle when I was 12 years old. And I had foot pain in my early 20s due to my flat foot. So I was given orthotics, which I wore for 1.5 years, 2 years, and, within my sneakers for a while afterwards. And then a few years ago I'd say about 6-7 years ago when I joined a running group, that same kind of foot pain came back. And that was when I discovered, there's more to going barefoot than just wearing barefoot shoes. There's a lot of exercises that need to be done, and realized that not only is my foot super flat, but I have probably, I would say, and maybe Dr. Connely will confirm this weekend, but I would 99% certainty say that my posterior tibial tendon on my right foot is probably completely torn. But I don't have pain. I can walk as far as I want. I continue to do foot exercises, but guess what? I can't really do a great single leg heel raise on my right foot, not without taking about 50% of my body weight off. So I'm pretty sure something's torn there, but I'm not going to have surgery on something that is not painful. So additionally, when I went on a very long 22 kilometer barefoot hike 1.5 years ago, wearing my new barefoot hiking boots, I would say about 2 kilometers in, I stepped on a weirdly shaped rock and I felt a bone in my foot dislocated. Like I felt it pop up, and I kind of hobbled along and I sat down and I tried to kind of relocate it because I really felt like it was just displaced, like it was subluxed, and I couldn't get it. And I had to hike another 17 kilometers, and it was painful and it was really not fun. It was an amazing hike. It was an all night long hike from Toccoa to the Dead Sea. And I had to hobble along silently. trying not to act like it was painful, because there I was touting the benefits of barefoot, and I was pretty sure I dislocated a bone in my foot. So the next day, my father, who was a doctor and an acupuncturist, I was telling him it hurt. So he started feeling around in my foot to see where to do some acupuncture. I heard something pop, and lo and behold, I knew that it was back in place, and I stood up and I was completely fine. But I do have highly mobile, highly flexible feet that require a lot of stability. So any issue I've ever had in my life has really been with my feet. So that's why I was really interested in knowing. So again, if any of you know or have a source for what commandments are related to different body parts, I would love to know, because all of my issues have been in my feet. And I hope to never have any more, but we're all a work in progress. And at any rate, I cannot wait for the course this weekend. I'm really excited. I'm really excited for you guys to hear today's podcast. I hope you enjoy. I appreciate your feedback. Please continue to follow on Apple, on Spotify. Please rate us. And I love, 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 love getting your messages. I love getting topic ideas from you guys. And I just love the feedback that I get. And I really, really appreciate it. Shabbat Shalom. Hello, everyone, and welcome to Holy Health. My guest today is Dr. Courtney Connely. Dr. Connely is a chiropractic physician specializing in foot and gait mechanics. She holds a BA in kinesiology from the University of Maryland, as well as a BA in human biology. In addition to her doctorate in chiropractic medicine from the National University of Health Sciences, she's the owner and operator of Total Health Solutions in Golden, Colorado. There she heads patient care with a specific focus on restoring gait mechanics and helping people to resolve chronic foot problems. Dr. Conley is also the creator of Gait Happens, an online education company helping people from around the globe improve their foot function. Together with her partner, Dr. Jennifer Perez, she has taken the past several years to develop online education courses to educate clinicians on foot anatomy, the importance of foot health, and the truth behind modern footwear. They've also developed mentorship programs available to both the clinician and the layperson. She's one of the founding members of the Healthy Feet Alliance, an international team of practitioners whose goal is to bring to light the benefits of natural footwear. It is her passion to prevent unnecessary surgical procedures by improving our foot foundation and creating a stable platform from the ground up. Dr. Connely lectures both nationally and internationally. So welcome.
Thank you so much for having me. I'm glad that, like I said, that we're doing this finally.
Yeah, me too. I mean, I have to say, I met you at the very beginning of COVID, and that was when I first got onto Instagram. And, I said the same thing. It happens to be that, there are so many people on Instagram that I find that, I don't know how to explain it. There's certain people that you feel like, I don't know that person, and they have all these followers, but they're just you could just tell, they're such a good person. I'm really going to like them. And one of the other people who I felt that way about, and at the time I didn't know he had anything to do with you, was Joe.
Oh,
who also I met very early on, and he just was such a lovely person, and you could just see so caring. And that was what I felt about you as well, so I'm really excited to kind of get to meet you now.
Well, you're going to make me cry. We haven't got started yet.
Wait,
thank you. Yeah.
Just know if you cry, I'll cry, because pretty much everything makes me cry.
Yeah. Joe and I met, teaching at a rock tape instructor summit, probably about 5 or 6 years ago now. So it's been, we do the long distance thing. So
yeah, it must be tough.
We make it work.
But exactly, you can make it work. I know you both have kids, and, and sometimes I think it's good. There's a lot of people in my community here in Efrat that make long distance sort of work, because I would say that a good percentage of either the husbands, and in some cases the wives, they actually work in the United States. So a lot of them are going and coming every week or two or every month or something like that. So we're kind of familiar with that here.
Yeah. Yeah.
So that's really great. So there's so many things that we could talk about.
Yes.
And, I just felt like if we narrowed it down a little bit, it would be helpful to maybe people to understand a little bit about certain foot issues that they may have. So if we did something to do with maybe some common foot disorders, people could really learn something. And then obviously we'll link to your Instagram page and your website so people could get more information. So
yeah, I think the bottom line with all of this is that from an educational perspective, as we were going through our education, somewhere along the lines, the foot part of it got a little kind of shoved underneath the mat, if you will. When I was in school, it was, if the foot hurts, put an orthotic underneath it. And then that was kind of it. Brace the foot, make sure they're in a nice cushioned shoe. And then what we started to realize was that there's more muscles in that area of your body than really anywhere else. And they can do a lot of function. So, when we talk about different diagnoses, I think that's kind of the underlying, at least our mission is the foot can get stronger just like any other part of your body. It can change shape. It can move more. It can move more with stability. And those are all the goals that we want to accomplish.
Yeah, absolutely. Just like almost any place in the body, you have to be able to control the motion. If you can't control the motion, you're asking for trouble.
Right.
So I thought if it's okay with you, we'd start with something like bunions, because I feel,
yes.
and I think that works well, because I think you guys are doing a series on that this week on Instagram. But
yes, we are.
I feel like people just think like, oh, it's genetic. My mother had them and my grandmother had them. And so of course I have them. And, I'd love to hear what you have to say about that and what people can do about it, what causes them.
Yeah, we are doing a bunion week. It's fascinating to me how many people are finding that interesting. It gets me very excited. So as far as where they come from, I always say you don't come out of the womb with a bunion. We inherit certain things, maybe hypermobility, right? So connective tissue laxity, if you will, right? But early identification of these things, right? So if I know my mother has a bunion and I have a daughter and I know that hypermobility might be a factor, then early intervention with our kids is massive. And that starts with the appropriate footwear and, letting their feet feel the ground. I think all of those things are very important, because at the end of the day, a bunion is simply driven from instability. So we know that when we're walking, we need a foot that is stable, a big toe that is rigid or aligned appropriately so that we can propel forward. If I have a foot that is weak or a foot that's unstable, or if I have instability being driven above the foot, all of those things can cause abnormal or aberrant load when it comes to the big toe. And then as a result of that, bunions start to form. I think we could have the conversation as far as footwear, but it really is a no-brainer. If my foot looks like this, it should be in a shoe that... Is this video too, or just audio?
It's video also. Yeah.
Okay, good. Okay.
Most people won't watch video, but that's okay. It's up on YouTube as well. You just want your foot to be able to expand in the shoe. So if you look at someone that has bunions, it almost looks like their foot is in the shape of a shoe. The toes are kind of squished together. You can start to see that, valgus deformity at the foot. So one of the lowest hanging fruits, I think, is to start with putting their foot into a shoe that actually feels good and is comfortable. And then from there, we start to work on all the things that I don't think they talk about, which is strength of the foot, awareness of the foot, strength from above the foot, on how the foot can be controlled from above the kinetic chain. So I think all of those are huge factors in not only delaying the progression, but in prevention. Like, I think the key here is with our kids, when we talk about foot dysfunction, I mean, most kids, and, they're not going to tell you, hey, mom, my shoe's too tight. They just don't. They're just going to run around, and then we're like sitting there trying to feel where their toes are. And, I think paying attention to their feet and putting them in the right types of shoes and allowing their feet to feel the ground a little bit more, that can have a massive impact on their function down the road. I absolutely agree. And I have to tell you that one of the most interesting cases, and I think it was kind of like how I met you, because I think I showed you this case, was I had a guy come to me. He was like 18, 19 years old, and he knew he was drafting to the Army about 8 years later. We have mandatory drafting here. So pretty much everybody goes to the Army. And from certain sectors of the country, they really want to go to like high level units and things. And he looked like this big, like strapping, strong guy. And he told me he'd always have foot pain. And, he had really flat feet. He took off his shoes. I'd like never seen anything like it, like super flat feet, like huge bunions. And it's just the feet didn't fit the person,
Yeah.
right? And so then in getting some of his history, it turned out he'd had some surgery that needed to be done on his pelvic floor when he was a teenager, like when he was in high school. And of course, it was after that his feet got so much worse. And by the time he went to the Army, though, he was, I think, the second fastest runner in his unit. And he's like a commander today. Like he's still in the Army, and
awesome.
He actually added on. So that was like really, really fun. Like he didn't think it could be done. His mom didn't think it could be done. And it just goes to show you. And again, like I'm sure you say the same thing, that it doesn't matter what it looks like. It matters how it functions.
100%.
Go on.
I can't speak to that enough. I mean, and that's what we're going to be talking about this week. I have two very pretty, I would consider larger bunions on my right foot. And I'm a triathlete. I've struggled with foot pain, is why I've got into this business in the first place. I worked in an orthotic lab. I was making orthotics. I'm trying to brace my foot. I'm trying to figure out how I stop this thing from moving and or hurting. And then I was like, we're doing something wrong here. Like I'm putting this orthotic underneath my foot. My foot might feel a little bit better, but now my knee hurts or my back hurts, rather than looking at the whole picture. And I think you brought up a great point, that there's a massive connection between what happens at the pelvic floor and what happens at the foot. And so I started strengthening my foot, and it worked.
How'd you know how to do that?
Lots of, that's exactly what I was talking about in my webinar today. Reaching out to people, right? Like when I started this journey, probably a good 15 years ago, there was this small group of, people that were starting to put out this information, a couple researchers, and I started reading their work, and I'm like, wow, this makes sense to me, and I don't think it's a hard sell. Like your foot feels better in a shoe that fits your foot. And so I started working on all this stuff. And then I was like, wow, I actually don't need my orthotic. Wow, I can actually run and not have all of this pain. Now, when you look at my foot, my bunions are still there. There's no question. I still have a large bunion on my right side. The inflammation is gone. It looks better, but it's still there. It's never going away. But I will tell you, what's not happening is nobody's cutting into my foot. Right? Because it functions fine now. I'm in the right footwear. I continue to do the work that's required. And, I tell all my patients when they come in here for bunions, if they're in here and they're questioning their foot for aesthetic reasons, like, should I get this surgery because it doesn't look pretty? I'm like, I have a big old conversation with that one. Because it's just not necessary. There's so many things you can do. And it will, in fact, if you put the work in, start to function better. And then it's like, well, it might not be the prettiest looking foot, but it functions. And, what more can you want there?
Right. And I feel like, people don't realize surgery comes with its own set of problems. Like there's and you still need to do the work. Like you're going to have to do the work anyway.
Right. And I think from a bunion surgery perspective, right? There is not a high success rate for that surgery. And the reason being, I believe, is that it's a symptom surgery. Like I said, you don't come out of the womb with a bunion. You can't do surgery to correct your hypermobility, for example, right? So the bunion is there because of aberrant load. What is happening when your foot hits the ground that's changing the load at the big toe? So when you go to start to make changes via surgery to that joint, without understanding why it was there in the first place, you can best believe that either the surgery is going to fail or you're going to have, in the foot, what's termed transfer metatarsalgia, right? Well, the big toe might not be hurting, but it transferred to the second toe, or it transferred to the third toe. And I have so many patients in here every week. Started off with one surgery, and then it was another one, and then it was another one, because you've just disrupted the integrity of the foot. It's a last resort.
Yeah, so I'm sitting here nodding my head. Most of you won't be able to see that, but because it is exactly what I tell people with any surgery. If you are actually going to have that surgery, if you don't figure out what caused you to need that in the first place, if it doesn't come back to that knee, it's going to go to your back, it's going to go to your hip, it's going to go somewhere else. So you've got to change the cause of all these things. If you don't, then you're fighting a losing battle. Like, it's just, going to be ongoing. So is there ever anyone, have you ever had a patient where you looked at them and their pain just didn't resolve and you felt like maybe they do need to continue this, but maybe they do need surgery as well, or an orthotic or something for that bunion as well? Or have people?
Sure. I mean, there's always, like I say, there's a time and a place. There's a time and a place. I think as a functional foot clinician, I have to have people come to me and trust me, right? I have to have a good referral source of, hey, if surgery is required, I want you to go to this guy. Now, I've been doing this for 20 years. I can probably count on one hand that I've referred out for a surgical procedure. I can't tell you what has happened in reverse. How many people have had surgeries and end up in here because of, hey, I just had a case the other day. She went to her podiatrist for bilateral bunions. So she had bunions on both feet. Okay. No pain. She was just concerned, as anyone would be, hey, what is going on with my feet and why are these bunions there? Now, rather than having the conversation of, why don't we look at changing your footwear? Because I can probably be pretty certain she was in the wrong type. What about any type of toe spacer? What if we looked at, none of those conversations happened. What happened was, let's do a bunionectomy on one foot and see what happens. And what they ended up doing was one of those while we're in their surgeries, and they noticed that she also had a little bit of a hammer toe on one of her toes. So they did the bunionectomy, and then they added a bonus surgery in there for her. Of course, now she has pain. She had to go back for a third surgery. So now this woman who had no foot pain, was just concerned about what was happening, is now in a lot of pain with 3 failed surgeries on her foot, and now she can't walk. I mean, it's literally heartbreaking to me, because I'm a big, I think walking is the most underrated physical activity. Like, we always talk about, where I live, it's like people are running 100-mile races and they're running, the power of being able to take a walk. And you want to talk about spirituality and all of that. It's where, like, I tap in, going into nature and into the woods and being able to take a walk and breathing and, doing all of those things that calm my soul. When your foot hurts, none of that happens, because every step that you take, it's pain. It makes you grumpy. You don't want to do anything. And when you can't walk, it literally interferes with everything.
I agree with you. And if you think about it, my people walked in the desert for 40 years. So I think that the feet and walking, and they were like in barefoot shoes or barefoot or in sandals, like feet are pretty important. And it's really true. You don't realize how much you use something until you can't use it. Like, that gives you a newfound appreciation. And I think
go ahead.
No, go on. Sorry.
I think from a movement perspective, like, when you say my people walk for 40 years, if you said to most people in this country, I want you to walk, you're going to walk for 40 years, they would look at you like you were like, our bodies were not designed to do that. We were designed as a human species to walk for very long periods of time. It's what we do. We walk.
Right. And the other thing I say is that when I started thinking about it, right, the foot has so many joints and so many muscles. And we know that if there's a joint, that place is meant for movement, and you have to be able to control that movement as well. But if that foot has so many joints and so many muscles and is really built to move, like, how could being in an orthotic, or how could being in a shoe that doesn't allow it that movement, how could that really be healthy for you? Because, God is smarter than all of us. And if like he created it that way, it was created that way for a certain reason.
It's the most it's his best work as far as I'm concerned, is that foot right there.
Yeah. Yeah. So I kind of feel like, I don't know, should we keep going on with like other foot disorders? I kind of feel like it's all the same, or I could just throw out some questions that might be a little bit interesting.
Yeah. I mean,
and I can cut anything.
Yeah. I mean, I think at the end of the day, when it's not, especially when I'm working with my clients, I try to tell them, leave your diagnosis at the door.
Yes.
I don't want you to be identified by your diagnosis. And unfortunately, by the time people get into my office, they've been, I had a patient that was told her foot was going to explode if she runs again, and choose words carefully. But you don't want anybody to identify with a diagnosis, because what we really want to do is look at function. Because if we just focus on correcting the symptom without looking at the underlying function of what caused all this in the first place, then 6 months later, you're going to be treating something else. And then, it's just this circle. So yeah, from a diagnosis perspective, yes, obviously there's specific things that we want to look at, for at the foot, for example, when you're looking at tendons and things like that, we know that we need load. But if you wanted to just keep it broad, it's, hey, get the foot to function, give it some strength, do some mobility work, and, take your shoes off every once in a while.
Exactly. See, I guess when people come to you, they know what they're getting. So meaning they come and they know that you're expecting them to change their footwear, right? So when they come to me, they're not always expecting that, right? Because I'm not Gait Happens and whatever it is. I mean, everything is barefoot in my facility. I've been barefoot in my facility since the beginning. And I've always explained to them why. For the past 3 years, I've gotten a lot more expertise thanks to your courses. And really, I've learned so much from you guys. But like, what would you say, like, to really encourage people? Like, I find it difficult. People are like, I mean, my favorite is like, oh, no, this is a really wide shoe. And I'm looking at it, I'm like, you've got to be kidding me. And then I'll pull out, one of my shoes or an Ultra, but convincing them that they have to change their footwear. I feel like it's not as hard for you because they know that's what they're going to get by the time they come to you. But
well, it brings up such a good point. I always say function over fashion, that's easy for me to say living in Colorado. Now, when I go to New York City, where Joe lives, and I see patients, it really is very environment dependent. My brother also lives in New York City, and my brother will call me and he'll say, I'm going to take you out to dinner. What shoes are you bringing? Because as my daughter would say, she came home from school the other day, and she was all upset. She's 11. And she was like, Mom. And I said, what? She's like, I'm really mad. And I said, what? She goes, all the other kids get to wear Nikes and you make me wear these platypus shoes. And I was like, honey, I would do most things for you, but buying you a pair of Nikes is not one of them. But yeah, I think it's a conversation that you have to have. And I actually don't think it's a hard sell. And this is why. I can't tell you how many patients will put on a shoe where their foot can actually expand. And they'll say, wow, you'll hear this. I never knew my foot could be so comfortable in a shoe. Or, wow, that feels so different. Or even it feels too big. Those are the types of things that you hear. And if you look at all the research, so Benno Nigg is a big researcher in our field, and he's done a ton of research on footwear design, what the shoe is supposed to do, because we get that question all the time. What's the best shoe for me? And there's a reason there's so many different shoes out there. But he would tell you, what the research says when looking at mechanics is it's the shoe that is most comfortable for that person, because that's when they're going to be relaxed. Now, my argument to that is, what foot is going to be more comfortable in a shoe that squishes their toes together versus a shoe that allows their foot to splay? So I always win because it's just more comfortable. It just makes sense. So, you have to kind of get past, you're not going to be wearing high heels. You're not going to be wearing, they're getting better though. I will tell you that the companies are improving. They're realizing that, some shoes, no matter how functional they are, people just aren't going to wear. So I think the designs are getting better. They're starting to get aesthetically more pleasing, if you will. But to me, it's a no-brainer. It's a very easy win with, minimal intervention. And you don't have to wear them all the time, right? It's like, start wearing them sometime.
Yeah. Well, I kind of explain to people like that as well. Like, also, listen, I don't expect you to go, especially here in Israel, because it's even more expensive here because we have a lot of import, most people listening to this we're English speakers. So like we can get them sent over from America with people. And there are many people that can do that. But even so, like, I'm like, don't throw out everything. Start with one pair. And as you replace your shoes, that's what I did. I started with one pair. I'm wearing like stunning Belenka right now. They look like Blundstone. Like Blundstone is the official shoe of Israel. So like, they make some really nice ones now. And I've pretty much the one that's closest to me, where they sell closest to me, like right in a regular store, is Ultra. So I get everybody to change to Ultra first. There has not been one person who didn't come and say, oh my God, this is the most comfortable shoe I've ever put on my foot. So I fully agree with you there.
Belenka is one of my favorite lines too. They make great products.
Yeah, no, they really do. And okay, so I have a question for you. Have you, or do you get a lot of situations? Because I don't always read the comments on people's, posts. Do you get a lot of like trolls or like people who start to argue with you? Because there are plenty of people who are still saying orthotics, right away, or supportive shoe.
I mean, it wouldn't be social media if there weren't any trolls, right? Yes, we do. Luckily, for the 160,000 people that follow us on Instagram, I can happily say that there's a few. There's mean people out there, unfortunately, and I'm very close to my work. I put my kind of heart and soul into that. So when I first started doing this, sure, there would be people that would say, this is false information, but on and on and on. And I would really take that to heart and, kind of literally lose sleep about it. And you have to have thick skin. You have to have really thick skin. But of course, I mean, luckily, like I said, there's not too many of them out there, but there's always going to be people that, and we are very open to questions, to challenge dialogue. Like, let's have the conversation. One of the ones that always catches a lot of heat is how the foot should strike. Are you a heel striker? Or are you a forefoot striker? Some camps out there say only forefoot strike. You can only, when you're running, it has to be a forefoot strike. And then, our kind of theory on all of that is it's not necessarily how the foot strikes, but where the foot strikes. So there's always going to be those little arguments that are going to pop up. But I think if you can have an intelligent conversation with someone and there's respect on both ends, then, you can get some quality learning happening.
Yeah, that's what it is. It's about the respect as opposed to just coming and attacking somebody and making a personal attack. And this came up for me because I posted the podcast with Dr. Perry Nicholson somewhere the other day, and someone literally like private message, but like attacked me like I'd never had anything like this. So I was like, oh, wow, that's an interesting question. I wonder if, I'm like, I better develop a thicker skin because I love a good debate. I spent all of COVID debating with people, but like it needs to be respectful and not, well,
really. And I'm with you. I mean, Perry's a good friend of mine, and I think some of our work, like I think Dr. Perry's work and both my work, I mean, we're still kind of tapping into some of this stuff, right? Like the research, I think, is coming with some of this. I always say, let research guide us, not shackle us. And there's some people out there that are like, well, the research doesn't support, lymphatic drainage, or the research doesn't support, walking barefoot or whatever. And my question is always, if you're actively seeing clients, right? And what I'm doing, I'm seeing positive results. So objectively, their range of motion gets better. Their pain is improving. Pain is a poor objective measure, as we know, but those things start to change. And then the client also says, hey, I feel better. I'm able to walk longer. Do you think I care if there's research out there that supports that? I don't. Maybe we are developing the research. Now, I let it guide my protocols. Hey, tendons need load. Great. But there are certain things where it's like, let's just see, everybody's going to respond to something different. And I think to downplay or to criticize someone else's work when they're helping, Dr. Perry helps a lot of people. Now, whether you like what he does or not, that's your prerogative. But he helps a lot of people. So,
I agree. He's but besides that, he's one of like the kindest, most amazing people around.
Nicest, yes. Kindest. Yeah.
And I actually got the award in school for most likely to win an argument with a teacher, because that was my big thing, even in PT school, is that I had one teacher, and she happened to be our clinical director, who was so evidence-based, only evidence-based practice, only evidence-based practice. And even then I was like, but this doesn't make any sense. Like if there's something, I don't care if it's psychological. If you use something with someone and they feel better, why wouldn't you use it? If it's not going to harm them, why wouldn't you use it? It never made sense to me. So I'm just nodding to every single thing you're saying. It makes absolutely perfect sense. And I do think go on. Sorry.
I was thinking about this just being on this podcast, the power of prayer. And I know we'll talk about this later.
We will, but say anything.
Show me, like, is there going to be research? Are you going to find tons of research on the power of prayer? And hey, if you pray about this, but come on now, right? Like,
there is research showing that people who know that others are praying for them actually have better outcomes after surgery. Awesome. Or if they're really sick, And if you don't believe that there's anything greater out there, then how well are you going to do? Like if you think that everything's up to you or it's just up to fate and there's nothing bigger in control, I don't know. I just don't think your outcome would be as good if you don't think that things could be changed from above.
Right. I agree 100%.
Yeah. So and if you want to talk to me now about spirituality, if you want to tell me, what does spirituality mean to you? I'd love to hear it. I want to just say one thing, that the reason I knew I wanted to interview you back when I was just thinking about the podcast, and it was way before I even got it started. It was when I did the course with you and Dr. Splickle, who I interviewed also at the beginning. And you said, I think it was like the things that were most important to you were like family, maybe it was your work, and like God. And I was like, oh my gosh, that's so not PC. Oh my God, I love her. She's amazing. Like it was just so meaningful to me that somebody was okay saying that, because people don't want to talk about God.
Yeah, they don't. It's very interesting. In my I have an angel in here I grew up Catholic. I have a rosary around my angel in here. My grandmother made that for me when I was born. And that's come into every single office that I've had. The wing broke. That was a sad day, but it's interesting. Some people will talk to me about it, and others, you even get I think discussing that is always can be uncomfortable for people, but as far as the business that I'm in, I think the gift that God has given me has been one of healing. Like that has been what my purpose is, which is why I don't think I will ever stop doing this. Like, if this is why I was put here, it's what God has blessed me with. And I wouldn't feel like I'm getting the job done if I just stopped doing it. I struggled personally for a while when I was in Chicago, with just certain things, to the point where you kind of hit that ground, like, people say they bottom out, and I remember sitting in church and I'm crying and I'm like, God, like, what do you want me to do? And it was such a difficult time. But I just kept at it, and he just showed me the way. And now I look back on that, and it was all part of this beautiful process. And now I can kind of be on the other end of that, and by the grace of God have come out of that kind of darkness, to be able to share my gift with other people. And it's just something that I'll forever be grateful for, and something that I want to, instill in my daughter, and I think that's important.
I have no doubt that you're doing a very good job of that. And I think that that's something that is often lacking in a lot of people. And maybe that's that essence of what I feel when I look at certain people's profiles, and I go on and off of Instagram, and you guys are one of the only ones that I ever look at and I really try to like and sometimes comment, and because, not everybody has that sense of gratitude. And I think that gratitude is such an important thing to recognize, that like you do have a gift, but like it's not just because like, oh, you're this amazing person. Like, it's gratitude to God and the people around you. And like, I know I feel so much gratitude to you for the things that I've learned, and for my own journey into becoming the therapist that I am. Also, like, I've talked about it publicly before, and I know Dr. Perry from, like, I met him when I worked in New Jersey, like a long time ago. And all of that was a piece of my gratitude journey, was recognizing like, oh, I saw this person and I learned about this from him. And that caused me to go here, and that caused me to go here. And, nothing happens by accident. And it's just showing that, we call it hakarat hatov, which I guess is really like gratitude, or showing that goodness and appreciating, other people, and the fact that we don't get to where we are on our own, that everything is a process.
Yeah. It's so important to be able to, communicate and talk to people, just like you said, your mentors. And I think that's where all this growth happens. I mean, you can't do this life, there's lots of obstacles, and we all have them. And to have a foundation of faith and friends and community that you can talk to, and that you can, get some peace with, I think is mandatory. And then you look back on the journey and you're like, wow, this was all part of it. God was holding me the entire way.
Yep. Even when you think something seems awful and you're at the bottom and there's no way out, there's always a way out. And usually, if you're a grateful person, you can look back and realize that often these things that were really terrible happen for a reason, and really lead you. And that's what I do try to tell, teach my own children. And it's one of my big things as well, is that, there's no such thing as failure. Like, it's not a wrong choice. Whatever choice you make is okay, because even if it doesn't turn out the way you want, you'll learn something from it and you'll go in a new direction. And the only time failure is if you stop, sit down, cry in the corner, and aren't willing to move forward. Right. And, I think we get our greatest gifts when we've had a setback, or, had to maybe try again and again and again at something.
100%. That's when all the good stuff happens. You just sometimes can't see it when you're in it, but on the other end of it, you're like, wow, God, thank God.
Yeah, no, it's really true. So I'm going to go a little bit in another direction now, just to ask you something else. I mean, I could talk about this all day, but I'm sure you don't have all day. So I want to ask you, so obviously since the beginning of COVID, like, I personally had never heard of Zoom until COVID. I heard of Skype, of course, but I'm curious to know, because most of Gate Happens, you guys are doing a lot on Zoom. And I'm just wondering how you feel as far as treating someone over Zoom versus working with someone in person. And do you feel one is better than the other?
God, it's such a That's such a great question. So when I started Gate Happens in 2017. About a year into it, after I was like answering emails and, spending hours and hours, a friend of mine said, you should offer virtual consults. So this would have been in the end of 2018. So I took Friday mornings. I left the office and I was like, all right, I'm going to see if, I can help people virtually. And so I started doing that. And the next thing you know, my schedule was getting booked Fridays on Fridays and Fridays. And I was asking for feedback because virtually you have to have good communication, because if you see them once and then you don't talk to them again, you don't know if what you're doing is helping them. And it's, I'm not going to continue to do virtual work if I was just not helping anybody. So we started to get some good feedback. Then when COVID hit, we shut down the offices and I opened up my schedule virtually for both myself and then my associate, Dr. Perez. And then things just got crazy because everybody was on Zoom. Everybody, and it's kind of interesting because foot pain seemed to have increased over COVID. And like, there's articles in the papers going, COVID caused my foot pain because I was walking around barefoot. And it's like, no, COVID didn't cause foot pain. Your weak foot probably caused your foot pain, right? It's now just being brought to the surface. So we started doing more virtual work. And now we have 6 practitioners doing virtual work because it is working. And this is why I think the virtual consult works. The compliancy, like we have it dialed down where patients will send us videos, or clients, if you will. Watch me walk. I can see them running. I can see them walking. You can do a full assessment. And we have videos that they watch. And then I'm always checking in every 2 weeks. How are things going? Can we tweak this? Can we do that? And we've had some pretty good results. Actually, excellent results. Now,
clearly you have 6 practitioners now.
And that's the only reason why we continue to do it, is because the need is there, because it is working. Now, with that being said, if someone said to me, should I do virtual or should I do an in-person? Always in person I'm going to prefer. I like the interaction. I like being able to feel and assess joint motions. I think that's very important. I think nothing can replace an in-person consult. What we'll often do, because now we have clients that will fly into Colorado, I will see them virtually. Right. And I'll kind of do this also, like, because I too am curious, because I'm like, what can you do? Are you really seeing the right stuff virtually versus when they're, and so I'll see them virtually. I'll say, I want to do an appointment with you virtually. And then when you come in live, when you fly in, we'll continue, get started on this stuff, and then we'll see you live. And I'm always like super excited. And I'm like, okay, like, just what I saw there is exactly what we're going to be working on here. So that's always reassuring that you can, have successes on both ends. I would say difficult cases, though, when there's been multiple surgeries, if there's a big biopsychosocial component, someone that's depressed, like it's always, I'm a big hugger, like I hug people a lot. Nice. I think that is very important, and that can't be replaced, virtually or online. So I think there's kind of the pros of virtual is you get access. You can help many people that are in places where they don't have access to this type of care. And then the pro of live, obviously, is the interaction with the person.
Right. And that's what I felt like also, is that certain people I feel like need kinesthetic awareness of different areas to actually make them work well. So I've also done some of it, and definitely during COVID, I did some of it. In general, though, I find if somebody's contacting me from somewhere far away, I'll try to find them a practitioner that I think would be good for them in their area. And if I can't, so I've worked with a woman in Germany. I worked with a woman in Baltimore, and it worked and they actually both worked really well.
That's it. That's my favorite, right? So I always say everybody that we do virtual consults with, the thing we always say is co-management of the case is key. If you can, I will jump on the phone with anybody you want that's local. If you have a physical therapist, if you're working with a chiro, give me their number and I will call them, because it's always good to have someone there. And it's what's really nice is when you get the virtual work and the third practitioner's there. So like I'll be doing a virtual consult and they'll have their physician there. Then I have somebody that's my hands.
Yeah. No, that makes a lot of sense.
I really like those visits.
So one more footwear question. I know I'm sort of jumping around a little bit. Sorry about that, but I think it's all fascinating. So how quickly do you want somebody to switch their footwear? Meaning if the foot is really weak, like you said before, right, that maybe my feet are hurting because my feet are weak, but I'm walking around barefoot, right? So how quickly do you want somebody to actually switch their footwear? Do you want them right away? Do you want them to?
That's a very individual kind of answer. If I have a runner, for example, who's been running in a Brooks with an 8mm heel to toe drop, and they have foot pain and I want to transition them into a different shoe, I'm going to go nice and slow.
That makes sense.
Right? I mean, because the foot has to be strong and the calf has to be strong. So if the strength isn't there, you have to be very careful, because they're going to come back in. You put them into an ultra that's a 0 drop and they're going to be like, my calf is killing me. So you don't want to turn them off, because once that pain starts to kick in, they're going to be like, oh my gosh, it's the shoe. And it's like, it's not the shoe, more so of what's you're putting into the shoe. So we just have to take that process nice and slow. Now, if I have someone that's coming in and it's just a walking gait and they have pain when they walk, I'll sometimes move them a little bit quicker because the foot's just going to be more comfortable. I will be very cautious of the stack height of the shoe though. So the stack height is the amount of material between the sole of the foot and the ground. So most of the minimal or functional footwear shoes out there have a very thin sole, because the intent is we have all these beautiful receptors on the bottoms of the feet. We want them to feel the ground. You have to be cautious if someone is standing, let's say their job requires them to stand on a cement floor all day long. If they're not used to doing that and you put them in a very thin-soled shoe, their foot is going to hurt. So we just have to, I'll put them in a shoe like an Ultra, for example, where the foot can actually splay, but I'll make sure that there's enough cushion underneath the sole so that they're comfortable. And then as we start to work on function, then we can talk about dialing it down. But one thing that I have learned is slow and steady wins the race here. You know, I think having a plethora of different footwear is very important. I was recently in a car accident 2 months ago.
Gosh, I'm sorry.
Yeah, and I flipped my Forerunner, so that was it was a rough day.
Oh my God.
And of course, I fractured my foot.
Oh my gosh.
Of all the places, you know what I mean?
It's Murphy's Law. Oh my gosh.
I know. And then I developed a resultant neuroma that got irritated. Now, I don't know if your audience, if any of you guys have had neuromas, they're not fun. It literally, every step that you take, it feels like your foot is, literally like there's a fracture in your foot. So I was dealing with a couple things. I can tell you, I was very glad to have my Ultras have a very thick cushion on them, because I'm not walking. Barefoot walking was extremely painful because I didn't have anything underneath the ball of my foot at push off.
Wow.
So, I have a pair of recovery sandals with a lot of cushion. I have a pair. So being able to know when, like time and a place. I don't want to put any of my clients, there's no reason to walk around in pain if the solution is just a little more cushion for a little bit of time.
Right. Right.
So I think that's important. That's an important, factor, is not everybody is going to be able to handle or need to have the same type of footwear.
So that actually kind of leads me back to what I said before about, right, God, the way God, created our foot for all this movement. I also kind of, piece of me feels like God created the world and it was not concrete. It was off-road or shetach or whatever the word is, trail, or right. So if you're on a cement floor, do you feel it might be better to have a little bit more cushion, only because then I feel like you have more adaptability?
Yeah. I mean, again, my office here it's basically like a thin piece of carpet on cement. When my foot prior to my accident was feeling great, I could walk around here barefoot all day long. Now, I've been doing this though for 10 years.
Right.
Now, I'm still in the recovery process from my accident. I'm no longer in a very 30 millimeter stack height, but I'm probably down to about a 10. So I can still kind of walk around, but I'm not walking around barefoot because it just doesn't feel good.
Right.
So
right.
At the end of the day, are you comfortable? Because if your foot is sore at the end of the day because you're standing barefoot on concrete, put something under it.
Listen, it makes perfect sense. It absolutely makes perfect sense. So, okay, great. So if anything else you wanted to add in terms of spirituality, is there spiritual practices that you have that are meaningful to you? Because I feel like spirituality can be different for everyone. And for some of us, it does include God. For some people, it doesn't include God. And that's really okay.
I kind of tap in all day long. It's kind of my, it kind of gets me through the day. We have our, time of prayer. Like my daughter and I will pray before dinner, things like that. She's so funny. She's been, ever since she's been 2, when we say prayers before she eats, her thing is, and dear God, please bless the blowing trees. So we've been praying for the blowing trees for 10 years. And I'm going to be very sad on the day she decides to stop praying for the blowing trees. So we have kind of allotted time, but then I think it's important also, kind of like breath work, if you will, just to pause and kind of collect, and be grateful, and to be reminded why we're here in the first place. That's why walking in nature is such a big one for me. It's a big spiritual kind of moment for me. I love being in the mountains. I love being outside. I'm a big worship music girl. So I get into all the music, and you get this just kind of chills, you just get all the feels, and I like all that stuff. So that's kind of how I think about it, is more of incorporating it, just like with anything else, into lifestyle rather than I have to pray. I've done, Bible studies and things like that, which I enjoy as more of an organized, kind of spiritual group, if you will. But I like the constant tapping in each day.
Well, I think that's really beautiful. Thank you so much. I really appreciate it. And what's the best way to find you?
Yeah. So gatehappens.com is our website. We do a lot of content on Instagram. So @gatehappens is our Instagram account. We recently started a Fit Feet program, which I'm very excited about and proud of. We did a lot of work. We basically designed a foot program that's individualized for the person. So there's a bunch of questions that are asked. There's pictures. You kind of get an idea of what your foot position is. And then based on the answers to that quiz, you're guided along a certain pathway. And it's great because we address foot function and hip strength. And so we kind of go the whole gamut, which has been fun. And yeah, so
It looks
that's
amazing.
kind of where you can find us.
Yeah, your content is amazing, and you really do share so many interesting things. And again, I knew you had the neuroma, but I had no idea that it was because you broke your foot.
Yeah.
Like I didn't hear anything about an accident, a broken foot. I just heard neuroma. I was like, okay, so she has foot pain. Like whatever, it happens, happens to the best.
Yeah, I think I had it. I think it's been, once a neuroma forms, it's there. The inflammation just changes, right? So I think when I got to the foot strengthening party a little late. I mean, I'm 46 now, so I think probably in my mid 30s, was kind of when I started doing all of this stuff. And that's why I'm such a big fan of early intervention, because now, I'm basically cleanup, right? I'm just trying to keep my foot stronger and stronger. But, some things have, that neuroma has been there.
Right.
So it doesn't take much, a car accident, a bike wreck, and then it got triggered. So,
Right. Yeah. I'm not even going to tell you how many single leg raises I can't do on my right foot. I'm still a work in progress as well.
We all are.
So, yeah. Well, listen, this was so much fun. I'm so excited to finally meet you. And maybe we can get you guys over here to teach in Israel.
I would love it.
Love it. I would love it. I have a good
That's
space.
one of my bucket list places to go. So
I can see Bethlehem from where I'm not from this apartment so much, but everywhere else I used to live. Where I live,
I'll be there in a second.
Yeah, it's really close. So we're definitely going to talk about that. But this has just really been so much fun for me. And I just want to thank you so much. I know you were in the middle of doing a webinar today and you took the time out, and I really, really appreciate it.
Hey, everyone. Welcome back. I have with me today my friend Yehudis Leiter. I know you guys remember her from the brilliance that she's brought to us on several occasions. And I'm really, really excited to hear what she's got for us this week.
Thank you, Dara.
My pleasure. So what'd you think?
Okay, so it was really interesting to listen to everything Courtney had to say about our feet and our steps and the importance of walking straight and upright. And I went to hear more than just what she was saying on your podcast. And I went to her website, Gait Happens. And what popped out at me was that right on there on her front page says, Gait Happens, every soul matters, changing the world one human soul at a time. Spelling soul, S-O-L-E. And I was thinking that I've listened to almost all your podcasts, and you ask everybody, what does spirituality mean to you? To the practitioner. And I was thinking that one thing that spirituality means to me is that there's a greater something, God, that is directing every step of our way. And nothing happens by chance. Everything is divine providence. And we were supposed to do this last week, as you know, and I had a crazy busy week. I got pushed off. It was supposed to be yesterday. Yesterday, my husband needed me to go somewhere with him. Got pushed up to today. What is today's date in the Hebrew calendar? Today is the 10th of Shabbat, Yud Shvat in the Chabad calendar, which those of you who have listened to me before, and Dara, you know me, I'm born and bred Lubavitcher. In the Chabad calendar, Yud Shvat, the 10th of Shvat, is a very big day. It is the day that the previous Rabbi Yosef Yitzchak, Joseph I. Schneerson, passed away. And a year later to the date, the Rebbe, his son-in-law, Menachem Mendel Schneerson, who is known around the world as the Rebbe, took over the leadership. Now, his focus and goal in life, and he put his heart and soul into it, was changing the world one human soul at a time, S-O-U-L. And I said, this is just it's like freaky, because that was his mission in life, to send emissaries to every corner of the world, to reach every soul, whether they're Jewish or not, particularly if they were Jewish, and bring Judaism and Torah to them. If they weren't, to bring them the 7 Noahide laws in order to change the world. And it was just really, really something to me to see that. And when he took on the leadership, he he gave a Hasidic discourse, a mimer, and the title of that mimer is Basti Lagani, or in Hebrew, I guess that would say Bati Lagani, I came into my garden. And it's based on the words of King Solomon in Shir HaShirim, in the Song of Songs. And the Rebbe taught it year after year, adding on and expounding on it. And in a nutshell, the premise is that the world is our garden. It's a garden. It's our job to manicure the garden and to beautify the landscape. And how do we do this? We do this by revealing godliness in the world and making it a divine garden. So basically, when Hashem created the world, he filled the world with his presence, as we know from like the breath. When we breathe in, we're breathing in the air of God. And then just like we step with our feet, he in some level took a step back from the world in order for us to be able to seek him, and through living a life according to the Torah, his guideline, his blueprint that he gave us, and mitzvot, we are reconnected with him and we make the world a better place. So God took that first step, and we are supposed to follow in his footsteps. So I'm going to focus on,
I like that,
not so much feet, but we step with our feet. I'm going to focus on the stepping and the walking and all that kind of direction. Mm-hmm. There's a pasuk in Deuteronomy, in Devarim, that says we should walk in Hashem's ways. Lalechet b'chol derachav. So the Rambam says that, what does that mean? It means to emulate Hashem's way of compassion and kindness. But, in the Torah, we have that major premise of Yehavta l'reacha kamocha, to love every Jew as yourself. So, if you're loving every Jew as you love yourself, then you're already doing, acting in compassion and kindness. Mm-hmm. So the Rebbe says that it means that just like Hashem is merciful and kind, so too we have to be. We have to walk in the ways of Hashem. We have to emulate his ways. And that means acting through, not acting through our emotional side and letting us go either to the left or to the right in any extreme, but walking down the path of Hashem, walking in the middle ways. Now, the first time you got me to come on here, you said, mm-hmm, do something like gematria or something like that. So I looked up to see how many joints are there in a foot. Mm-hmm. And there are 33 joints in mm-hmm. a foot. And God created man. We were created with 2 feet, unlike animal that many of them walk on 4. We walk on 2. So 2 times 33 is going to bring us to 66, which is the gematria of El Ha. Aleph Yud Lamed Chaf Hey, I will walk.
Oh, wow.
So, Dara, you in the introduction to Courtney's fabulous lesson said that we have to be able to control the motion, otherwise we're asking for trouble. And Courtney said it's very important when walking to have stability, because otherwise we're going to end up with bunions. So, Elcha, I will walk. You got to be able to control the motion, control where you're walking. Otherwise, you're going to have those bumps. The bunions are like a bump.
Right.
And you don't want to go down that path, because you don't want to be identified by a diagnosis. Just like she said, you got to focus on correcting the underlying causes and giving the foot the strength. So the same is with us. You don't want to OTD, off the derech kind of, or on your own derech. You don't want any diagnosis. You want to follow that middle path and walk in the ways of Hashem. And we're going to move on to another pasuk, where in Mishlei it says bechol derachecha. So again, we have the derech, the walking. Da'ehu v'hu yiyasher orchotecha. If you know him in all your ways, knowing God in all your ways, God will straighten your paths. So what does it mean to know God? It means to know his ways inside and out, and recognize that he is the ultimate. Trust in Hashem. Trusting in Hashem, your emunah and bitachon, is going to get you guaranteed a straight path. So Courtney says that you need transition shoes. And you need to do that at the pace that the person is up to, so that the change will last. So I have a great uncle who always said, slow and steady wins the race. Just understand God's ways, follow his paths. Don't try to get it all. If you're off the path, get on it back a little bit, slow and steady, follow his ways, ask for guidance, and you will be in the right path and you will have that stability. So there's another pasuk where it says, Ubelechdecha baderech. When you walk on the road. What does this mean? It's also in Deuteronomy and Devarim. Sefer HaMa'amarim says that it's referring to that one should study Mishnah. The six Shisha Sidrei Mishnah, the 6 sections of the Mishnah are divided into Pesukim. And if we take the word Mishnah and turn the letters around, we get Neshama, our soul. So we're playing again on the soul. Right. And this, by repeating Mishnayot as you walk the streets and wherever you are bringing tremendous benefit in the form of general and individual protection to the world. And we know that the world now more than ever is in need of a purified atmosphere. So by walking around, and even if you're repeating the same Mishnah that you memorized over and over, you are illuminating the bond between Hashem and mankind. And that brings me to our prayers, our morning prayers. We say in the blessings, we're blessing Hashem for, we slept, he gave us back our soul, and we're thanking Hashem for all the goodness and different stages that he gives us in different manners. And one of the brachas are Hamechin mitzadei gaver. Hashem, he who makes man's footsteps stable, or it can be translated literally to prepares the marches of man. So what does it mean, prepares the marches of man? Hashem created man with limbs and vertebrae, but his part of man's movement isn't limited just to providing legs and giving us the power to walk. Hashem Mechin, he prepares the marches, the tzadeh, steps of man. He accompanies us and prepares our every step in life. Nothing happens without, like I said in the beginning, hashgacha pratis. Everything is divinely ordained, divinely organized. And we got to really believe that, in that concept of hashgacha pratis, because that's going to lead us. If we believe in Hashem and we have emunah, we're going to go down that middle, straight, right path with stability. And similar, and why do we have this bracha that we thank Hashem? Because we take walking for granted. Most of us take walking for granted. It's something that you just do. You get up and you go. But when you think about it, a parent gets all excited and cheers on that baby's first step. And then when the baby gets stable, you're so excited. The baby's learning how to walk. And then we're holding onto the furniture. It's going on its own. So the same thing is with us as adults. We have to realize that walking is an amazing gift. We have to take care of those limbs and vertebrae and legs that God gave us and protect them, and thank Hashem with our gratitude, because the deeper perspective of the bracha is that our unique lifestyle and our unique steps in life, or the path that we each as an individual go down, is only because God is guiding us. Hashem is with us every minute of the way through that path. Like it says in Job, the bracha is said in present tense. Hamechin mitzadei gaver. He prepared, because Eov says that all my steps shall be numbered, meaning that it's predestined how many steps a person is going to have in his life. And it's up to you where to take those steps, and when and how and in what direction, because you could take them for the good or the opposite, for not so good. And just like we said, when Hashem stepped back out of the world, took a step back figuratively, it was that we would seek him out through our free choice. And we have that free choice to decide, do we want to take the steps towards doing a mitzvah or the opposite? So one last pasuk that I'm going to bring up is that in last week's Parshat Bo, the pasuk says that Bnei Yisrael, the Jews, went out of Egypt and they went without food. They had no time. They took the bread over their shoulders and it had no time to rise, and they ended up with matzah. Now, like, how irresponsible, you know? I mean, you're going for, like Dara said, 40-year journey through the desert, and you're going to be walking and it's going to be hot and you're not taking any food with you. But it wasn't that. It was that they knew that Hamaychin Mitzadei Gaver. They knew that Hashem is going to prepare their steps. And they knew they knew that if they know and have emunah in Hashem, He will strengthen their paths. And they just had that complete faith. And the proof in the pudding is that later on, Rashi says, Zacharti lach chesed ne'orayich, and the pasuk continues, Lech teich. Again, we have the word of walking. Midbar. Hashem says that He remembers that we went after Him into the desert, into a land that was uncultivated. Now, my father, in his series of books on the Torah, V'dibarta bam, says on that no word in the Torah, there's not even an extra letter in the Torah. Every word is thought out and accounted for. So why would it kind of have like, that's like, either it's an oxymoron or it's redundant. Acharai b'midbar, be'eretz lechtech acharai b'midbar. You're going after me into the midbar. Be'eretz lo zerua. Either it's a midbar or it's not. If it's a midbar, a desert, then it's uncultivated. If it's cultivated, then it's not an eretz lo zerua. If it's cultivated, then it's not a midbar. It's got to be one or the other. So we got to change that lo, be'eretz lo zerua, in a land that is uncultivated, to be'eretz lo, instead of a lamed aleph, meaning no in Hebrew, to lamed vav, meaning to Him. And we have to make that, we have to follow the way of Hashem, follow Him to an eretz lo, to Him zarua, that is cultivated to Him. Meaning we have to purify this world, which is a barren desert in reality, if we don't have the spirituality in it, and cultivate it for Him. For Hashem. Right. So I'm going to end with a little story.
Okay.
A woman was on her end of her diet seeking journey, and she went to her diet coach, dietitian, and she said, you know, what can I do to finally lose those few extra pounds I'm stuck with? And the woman told her, okay, you know what you need to do? Get yourself to Walmart, buy a pedometer. It's going to count your steps. 10,000 steps, you got it made. So she says, okay, that's easy. She goes down to Walmart, picks up a pedometer, $12.99. Yay, hooks it up, starts walking around thinking, I walk everywhere. This is going to be easy. Well, at the end of the day, across the parking lot, up the elevator, down her hallway, picking up her kid from the bus, she did not reach her 10,000 steps. She was very disappointed. She figured, okay, she's got to trick the pedometer into walking, into counting, into adding up and making it all work. So it took her a few days, and she finally figured out how to get the numbers that she needed. Kids, pets, anyone needs fresh air, errands, anybody needs a favor, anybody needs anything done. And she realized slowly that 10,000 digital glory, it all added up. And she realized that, hey, she's losing and gaining all at once. She's losing the pounds and she's gaining all these, fresh air, help, whatever she's doing for everybody else. It's inspiring. Wow. Okay. So she says, you know what? Come on and join me. Let's backtrack. Let's take this a step deeper. Backtrack to day one of life. And instead of a regular walking pedometer counting the numbers, let's put on a spiritual pedometer. It's going to be set at 0, right? Because God created us and we were nothing.
Right.
We're just, so forward march, the days and months, everything's going to pass on. Those elusive numbers, we're trying to get to 10,000 steps. Sometimes only God knows the numbers are registering, they're increasing, but it's our spiritual pedometer. So we have to know what we're doing and we have to know how to make those numbers work. So we're going to start with a 3-step program, and it's going to be all inclusive. We're going to start with step 1 being God, step 2 being the Torah, step 3 being the Jewish people. Awareness of God. Without belief in something greater than ourselves, we're stepping nowhere. We're getting nowhere. We're going to just walk around in circles. World can be seen as merely chaotic. But if we are aware of that, our steps have to be with God. That all your steps have to be with God. The world becomes down the middle path and becomes a stable place. Next, we're going to take our Torah. Step 2, the Torah was the blueprint, our compass that God gave us for living. It was given to our nation over 3,000 years ago, but still it remains as timely and authentic in its wisdom today as it was then. So we take the Torah, we follow in its path, and we keep going on that straight middle way, and we keep walking with a focus. We know where we're going, like you said, or Courtney said, that even your kids' feet, check on their shoes now so that you will help set them in the right direction and avoid issues later. Same with the Torah.
Mm-hmm.
Give them the Torah true education so that you avoid issues later. Step 3, the Jewish people. We have been a Jewish nation from time ever back, and that is what got us through all the pogroms and the wars and everything else. Our survival was based on our helping another Jew through our achdut, through our being there for each other. Bein adam l'chavero is sometimes more important than bein adam la'makom. And this way, if you're feeling aimless or lethargic, that spiritual pedometer is quietly waiting for you. Take the 3 steps, God, Torah, and the Jewish people. The daily steps towards God, towards the Torah, and to your fellow Jew are all going to rack up in numbers, and you will step lively throughout life.
That was amazing. I loved it. Thank you so much.
You're so welcome.
I knew you would do a great job. Thank you. It was really, really wonderful.
Okay. Thank you, Dara. You make me study.
I love it. And you always do. And you always come up with great things. Thank you so, so much.
You're so welcome.
This podcast is for informational purposes only. Please seek guidance from a trusted healthcare professional. By listening to this podcast, you release Holy Health and any of our guests from all liability. I'd like to thank Joker Productions for editing this podcast.